إذا كنت من المتابعين الجدد اشترك الآن في القناة ليصلك الجديد بالضغط على الزر الأحمر أسفل القناة مع تفعيل الجرس، ولا تنسوا دعم المقطع بلايك. شكرا لكم جزيل الشكر.
Symptoms and causes of the disease. Colon perforation is a condition resulting from a hole in the internal colon in cases of irritable bowel syndrome, as a result of a minor or injury affecting the inflammation of the system. In this video, we will talk about structure, symptoms, and how to treat this condition. Causes of intestinal perforation. There are a variety of reasons that may lead to intestinal perforation, including the following. 1. Some medical procedures may lead to colon perforation. And below we mention examples of some of those procedures. An enema is used by inserting a tube into the anus. If this tube is inserted forcefully or incorrectly, this may lead to a hole in the lining of the colon. Cleaning the intestines before colonoscopy, especially in patients with a history of constipation. The colonoscopy itself may also lead to the same result, but this is a rare problem. Sigmoidoscopy, which uses an endoscope. Colon perforation is also rare due to this medical procedure. Abdominal or pelvic surgeries. The risk of colon perforation increases during surgery to treat colon cancer. 2. Pathological causes. Some pathological conditions lead to intestinal perforation. Below we mention some of these pathological consistent diseases related to inflammation of the intestine, such as Crohn's disease and ulcerative colitis. Severe intestinal obstruction, especially in the case of weak colon, and this occurs as a result of some diseases such as cancer. Ischemic colitis, which is related to blood flow to the colon. Colon cancer. Foreign bodies, such as fish bones or bone remains. These foreign bodies may not be related to food. Stool accumulation. Risk factors for intestinal perforation. There are some risk factors that increase the possibility of intestinal perforation, which are previous or recent abdominal or pelvic surgery. If you are over 75 years old, medical history of more than one disease, the abdomen or pelvis has been injured, such as in an accident, taking some medications to treat colon cancer, scar tissue in the pelvis, often formed as a result of surgery, birth process. Symptoms of intestinal perforation. The symptoms of this condition vary from one person to another depending on the cause of the infection. These symptoms may begin gradually or severely. Below we mention some of these symptoms: severe and widespread pain throughout the abdomen, severe cramps in the stomach area, bloating, nausea and vomiting, change in bowel movement, anal bleeding, fever and chills, feeling unwell, anorexia. Diagnosis of intestinal perforation. There are a number of medical procedures that help diagnose this condition, including computed tomography of the abdomen, using a barium enema, but this procedure in itself may increase the possibility of colon perforation, as we mentioned at the beginning of the video. A complete blood count test reveals the percentage of white blood cells, which increase in the case of infection, and a high percentage may indicate a long-standing colon perforation. A complete blood count test also reveals anemia as a result of bleeding. Is intestinal perforation dangerous? If this condition is not diagnosed and left untreated, it can lead to many serious complications, such as bleeding. These complications occur as a result of intestinal components such as stomach acids, food particles, and bacteria leaking into the abdominal cavity, which contains many internal organs. As a result of these components leaking into the abdominal cavity, inflammation, infection, abscesses, or the formation of a large area of pus inside the abdomen occur. And these complications are accompanied by severe pain, which is known scientifically as peritonitis infection, which leads to other types of infections that are more widespread. such as blood poisoning, which is a very serious and life-threatening infection. Treatment of intestinal perforation. Treating this condition often requires surgical intervention in what is known as intestinal perforation, because laparoscopic treatment of colon perforation does not suit all cases. Therefore, the specialist surgeon may resort to open bowel surgery, which may result in a colostomy, which is a procedure that depends on the formation of an opening outside the stomach to drain stool into a small drainage bag while the colon heals. In the early stages of recovery from this surgery, the patient will not be allowed to eat or drink until the inner lining of the colon has had enough time to recover. A nasogastric tube will also be installed for the patient to drain stomach components for a period of time. The patient will also be fed through intravenous nutrition and intravenous injection of antibiotics while he is in the hospital. In all cases, in order for the patient to return to his normal life, it is necessary to follow the advice of the specialist doctor after undergoing surgery in order for the colon to recover.
لو عجبك الفيديو ما تنساش تتفرج على الفيديو ده وكمان الفيديو ده، وما تنساش تعمل سبسكرايب للقناة وادفع خدمة الجرس علشان يوصلك كل جديدنا.